इसमें अलग क्या है?
कोल्ड स्टोरेज डिलीवरी, इंसुलिन फॉर डायबिटीज एंड अदर मेडिसिन भी।
लेकिन इससे होगा क्या?
मैम मेडिसिन फुल्ली इफेक्टिव रहेंगे।
पक्का?
सर अपोलो 24/7 से हैं।
एक्चुअली इनको डायबिटीज है। नीडेड टू बी श्योर।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए पाएं कोल्ड स्टोरेज मेडिसिन सिर्फ 4 घंटे में डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
रिपोर्ट सारी तैयार है?
हाँ सारे हैं।
सब एक्यूरेट है?
ऑफ कोर्स अपोलो 24/7 से है।
आपको तो पता है ना पापा, योर थायराइड रिपोर्ट्स हैव टू बी एक्यूरेट।
इट्स ऑल राइट, तुम बिल्कुल अपने माँ पे गई हो।
हेल्थ के मामले में श्योर रहना जरूरी है, इसीलिए हम देते हैं एक्यूरेट रिपोर्ट्स, वो भी एक साथ टाइम पे डायरेक्ट अपोलो से। डाउनलोड अपोलो 24/7 नाउ।
Morning Apollo family. Today is World Thalassemia Day, and to observe it on Apollo 24/7's Health Hour, we have invited Apollo's expert hematologist, Dr. Srikanth M, in a live session. You can ask all your queries about blood disorders like thalassemia, anemia, or blood cancers like lymphoma or leukemia. You must be knowing the symptoms like nausea, fatigue, or easy bruising or swelling of lymph nodes. Other than these, what are the other symptoms to look out for? What are the treatment options? Let's discuss everything about blood disorders in today's Apollo 24/7's Health Hour. Join us at 11 a.m.
It's always been there, standing between you and your health. A wall between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar, namaste, and welcome to Apollo 24/7's Health Hour, a show which brings you experts from Apollo every week. This show is a show where you can ask your queries on the live show. You can ask your queries on YouTube chat. Please give me your questions in complete details. We are going to talk about blood disorders. Joining us very shortly is Senior Consultant Haematologist from Apollo Hospitals Greams Road, Chennai, Dr. Srikanth M. You can ask your questions about any blood disorders. Please type in the YouTube chat box with complete details, okay? With age, gender, and all possible details in one question rather than splitting your question, which will be easy for me to find your question and ask. All right, so on the show, we are going to meet our specialist very soon. But let me talk about an interesting initiative which is done by Apollo Foundation. Sachi, Saving a Child's Health Initiative. No child should go without a good medical support, just that they are economically backward. That is not the reason that a child should be deprived of health. So Apollo 24/7, in association with the Apollo Foundation, is come up with this free pediatric consultations for every child in need. Top pediatricians who are renowned Apollo pediatricians, more than 10 pediatric specialties are available here, who are benefiting children across India. Scan the QR code which is on the screen to know more, and please do spread this good word. Well, let's talk about today's topic. We're going to talk about blood disorders and all that you need to know about it. Joining us is Dr. M. Srikanth, who's a senior consultant hematologist from Apollo Hospitals Greams Road, Chennai. And he is experienced with more than 25 years as a hematologist, and his achievements are ranging from GCRF Fellowship, Royal Marsden Hospital, Drug Development Award in the Institute of Cancer Research. He has published articles in national and international journals, and also as a professional holds professional memberships of American Society of Hematology, Royal College of Pathologists, British Society of Hematology, European Society of Hematology, and Royal College of Physicians. It's an honor and pleasure having Dr. M. Srikanth here on the show. Namaste, Doctor. Welcome to the show.
Good
Doctor, can you
morning.
hear us? Good morning.
Yes, I can hear you. Good morning. Namaste, namaskar. Thanks for having me
Right.
on the show today.
Thank you, Doctor. And today is World Thalassemia Day, and it's important to talk about thalassemia and spread awareness. And can you please guide us about thalassemia? What is thalassemia and how important is to spread awareness around it?
I think we all know hemoglobin, I think, because if it is low, we say we get anemic and our blood count goes down and we get tired, And say sometimes, unfortunately, when kids are born, they have this problem, so they are anemic. And usually, what happens is that there is heme and globin, that is a protein which is produced by the bone marrow, and that is responsible for carrying oxygen to all parts of your body. Supposing, say, for example, if you there are two types of thalassemia, one is alpha, one is beta, we say so. And also there are two different presentations, what we call as minor and major. Say major means most of your genes are affected in the beta,
Okay.
and your ability to make the hemoglobin is defective, so that the blood, even though it's produced, gets destroyed. So what happens is that there's less oxygen. So because there is less oxygen supply, the child is very tired, weak, and if you look at the blood counts are low. So what happens is the body has to somehow produce these red cells. So the bone marrow, which is where the factory for the blood production, starts producing, and when it produces, I think it expands. So and also the other organs like the liver, the spleen get enlarged as well. So basically, these kids need to have blood transfusion regularly, because our red cell half life is around 21 days. So every 3 weeks to 4 weeks, because it's defective, they have to be maintained on transfusion. So, and I think as they grow up, they have a lot of complications. Say, for example, if you don't have enough oxygen, say you feel very tired, weak, headaches, and you can't concentrate. Even when they go to school, they are not able to do the work properly. They have all the milestones, what they achieve is also reduced. And as they grow up, you can see they have other organs which are affected, such as the heart, the lungs, the spleen, the liver, because they receive multiple transfusions. There's a lot of iron which goes and gets accumulated as well, and that can cause damage to various parts of the body as well. So in one angle, we are giving them blood to sustain them. In another angle, we're also giving
That
them
is
more
correct.
iron from the blood. So it's quite a difficult thing, but I think we have now we have come a long way in the last 3 decades, because we have now effective ways where we cross match blood, and also we have a lot of ways how we remove the iron from the blood, and also we are able to monitor. And recently also I think we are able to change the bone marrow in terms of transplantation as well, so that they have a new bone marrow and they are able to get back to the normal life. Now, exactly in contrast to it is your trait, where they don't have any problems, but they carry it and they can pass it on to the next generation. So it becomes important future on, I think, in terms of prevention of it. If you have a thalassemia
Right.
trait, it's important to know.
Correct, correct. So, doctor, understanding thalassemia is at a next level, and they should get blood transfusions. But what about regular anemia, which is like across globe, across Indian women especially?
Mm.
How about simple anemias? What are the range of anemias here?
Yeah, see, I think anemia again is a very, it's the most easiest and the most complex thing actually, you will come across in hematology, because I think right from as a young child to a teenage girl to a middle-aged woman to a older age person, there are different reasons why each one can get anemic. I think in younger age, the most commonest thing what we say is, if you don't eat properly, you don't eat the right things in the food, then maybe you can get deficient. Now again, in anemia you have what we call as dietary deficiency. See, the commonest cause of anemia is iron deficiency. So that is, you don't take
Correct.
enough uh, iron in your
Yes.
diet, or the other reason might be you're taking enough, your body is not absorbing, or you're losing it. Say for example, women in their who
Menstrual
have
flow
excessive
or
periods and they have heavy periods also become iron deficient, because I think the monthly blood loss is quite severe to the amount what is being taken in. So I think there is a deficit which is happening, and then I think it actually adds up over a period of time, and then you see they become anemic. Now, on contrary to this, say for example, if someone is over 60 years where they are not menstruating or something, and I think if their diet is good and they're still getting anemic, then there might be something more serious. It could be something like a bone marrow related problem, or it could be something where they're losing blood from the
yeah.
internal organs, or like the stomach or intestine, or it could be starting signs of something serious as well. So it's important to identify what is the reason and
Yes.
when to get
Consult
expert
a
help as well.
hematologist.
Mm.
Right. So, understanding COVID has created a lot of blood clot issues. Post COVID, we've started to talk about blood clot issues,
Hmm.
which were earlier also there. But what complications can one who's recovered from COVID can expect of thrombosis?
Yeah. See, COVID actually in the last 2 years has taught us a lot, actually, in all the various organs of the body as well. And I think we are still learning about COVID. What we saw in the first wave matured, and then in the second wave, in both the alpha and beta and things, we have actually started learning a lot. I think COVID can actually cause a lot of blood related issues. Say basically, if you take the platelets, for example, the most commonest thing what we see is the counts go down, either because of suppression or either because the body is destroying, and even the white cells also goes down. And again, anemia as well. Anemia can be direct suppression because of the infection, or even we all know once you get COVID, you're not back to normal after some time, and then again deficiencies again can happen, your dietary deficiency, and again your bone marrow also might be suppressed. So
Right.
in another important thing is the thrombosis, what you said as well. So the COVID is actually a viral infection. There's a lot of inflammation which is being produced, and also there are some markers in the blood like the D dimers and things which gets elevated, and certain proteins as well. So what happens is, in essence, is the blood tends to clot more. And again, pulmonary embolism, which is means clot in the lungs, is quite a serious complication of COVID, and it can happen even when you're in active COVID or even post COVID as well. We have
Post
seen
COVID.
patients who come with blood clots, and some people who had long COVID as well has had blood clots either in the lungs or in the legs. So it's quite
Yeah. Doctor, while
common
you're
to see.
talking about this, sorry to disturb you here, but while you're talking about this, I thought I'll take a question from our audience who's A related
Hmm.
question. Ravi Battula is asking, post COVID, my D dimer values are elevated and it caused a blood clot in the hip area. Started to use ecosprin, but a cardio doctor suggested to use anticoagulant rivaroxaban. Is there any other
Correct.
thinner which dissolves blood clots in narrow hip vessels and restores blood supply once blood restored? Can osteogenesis, new blood vessels can be formed? How to increase blood circulation?
See, I think the basically what it is if you have a blood clot, what we are doing here is see when blood clot is actually what happens is blood flows through a tube. I think it's a simple physics. I think if there is a clot, what happens is again other cells will come and stick there. So what you're trying to do is making the blood thin. Thereby, what we are doing is preventing the clot to not to progress. Say, for example, if the clot progresses, goes into the lungs, then it could actually have an impact on the heart. And that's why I think rightly your cardiologist mentioned to you to start some blood thinners. See, I think traditionally when we started using with vitamin K antagonists, say, few years back. This was 2-3 decades back where you took warfarin or coumarins. Then you had to take the blood levels and monitor the INR, and also you had restrictions in your diet. Then I think came the NOACs, which is the novel anticoagulants. No, there are three classes of them. One is your Xarelto, which is the Rivaroxaban, which I think you were given, and then again there are another like Apixaban, and also you have Dabigatran as well. So you could use whichever one of the three. I think. All three have different side effect profile, and you have to see the other blood tests, the kidney, the liver test, and also the ease of use, whether you want to use it once or twice, and then you take it. I think rivaroxaban is easier because I think first after the first 3 weeks you just take it only once, so I think it's quite easy to use as well.
Right. Aditya Kumar's next question, doctor. Male 30-year-old, I have thalassemia and I'm concerned about high bilirubin levels, 2.5, and SGPT is 95. Is it related to thalassemia or something else?
Okay, that's a very good question, actually. We come across this quite, as I told you earlier in the starting, we have two types. One is minor and one is major and one is intermediate. Minor is something where you don't have a problem. Major is something you're born with the problem right from birth and you always need blood. Intermediate is something which will, by the third decade or the fourth decade, you might receive, you may have blood transfusions, because what happens is the phenotype is such that it doesn't come out quickly, it comes after a period of time. Now when the red cells break down, you get bilirubin, which is the end component of your breakdown. So if you're having a bilirubin, then we have to see which type of bilirubin it is, and also we have to see how the organs are, whether they are enlarged, and also we have to look at the blood film. So in that we will know whether thalassemia is the cause of your raised bilirubin, or bilirubin itself can be raised due to any liver problem as well. So I think we have to study this in terms of your gene profile. We have to look at the other blood tests to see whether the problem with your bilirubin is because of the liver or is it because of the thalassemia which has caused it.
So yes, Aditya, further investigations are required. You can consult Dr. Srikanth on Apollo 24/7 app, or you can continue consulting wherever you are. All right, doctor, I would want to understand what are the types of cancers of blood. 'Cause a lot of people are asking multiple questions about. So one brief, what are
Yeah.
the ranges of cancers of blood?
Yeah, see, I think we say in essence, we say liquid tumors. You see, I think the bone marrow, the lymph nodes are like a one unit together. So I think the most dreaded, what we say, is the leukemia, that is the blood cancer, which commonly says. Now, bone marrow produces red, white, and platelets. The white cells protect you from infection. When the white cells are there's a defect, or when there's lots being produced, then we say it's cancerous. Now, again, there's an acute cancer and a chronic cancer. Acute comes over a period of days, and it can usually be fatal if we don't treat it. Whereas the chronic goes on for years, and usually they do take treatment like how they take for diabetes or high blood pressure, and they are okay. So I think one is your leukemia, the other is your myeloma, what we call as cancer of the bone marrow, which affects the bones, affects the kidneys, affects your calcium, and usually there are holes in the bones, and that is another type of blood cancer. Then we have the lymphoma. What lymphoma is basically swelling of your lymph glands, either in your neck, armpit, or inside your tummy. So those are the different types of cancers what we encounter in hematology.
So, Doctor, here's Sunny Mishra's question about a cancer. My age is 21-year-old. I am male, patient of acute lymphoblastic leukemia, ALL, and I want to know how to live a healthy lifestyle.
I think congratulations to you, because I think I presume that you have had the treatment and you're in remission, and it's been a few years. And I think childhood ALL has been the biggest success of treatment. I think because 90 to 95% of children get cured when they have ALL, and they are able to lead a normal life. And I think in terms of monitoring and follow up, you probably have to follow your local hematologist's advice, whoever has treated you, in repeating the blood test, and also the hormone test, what we do, your thyroid profiling, your calcium and everything, once a year. And I think healthy lifestyle, you can return back to your normal things. We say eat a healthy diet, do your proper exercise, and I think we normally say with ALL patients, once they are past the 2 year mark, then the chance of the ALL coming back is very minimal. And I think we have had patients who come once a year for their follow up, and who have grown into adults as well. And I think that's the big success story of the ALL, what we are seeing.
So I hear a positive side of a story and child blood issues, cancers of blood in children. You mean to say that they have a nice positive hope they can grow up
Yeah.
and be cancer free?
Yeah, I think, see, in the early 2003, the trials which the Germans did, I think they used a lot of medicines, and I think the protocol was quite intensive. It went on for 2 years, and we were able to check the bone marrow for what we call as MRD, from the minute amount of leukemia cells, and we were able to give them accelerated treatment. So what this outcome went on is to have a 90 to 95% success rate of cure, So in essence, what we are saying is ALL childhood cancers are now we are curing, and they are able to lead a normal, healthy life.
Wonderful, doctor. Such positive news today. So, also asking all our audience who are watching this live on YouTube and also on Facebook and other platforms, please do ask your question only on YouTube chat. And if you can type all details in one question, that will help me to scout through your questions. Please do type all details in one question, please. Thank you. Next question is Sudeep Bishwas. I have thalassemia beta trait, 44 years male. My hemoglobin is on the lower side, 10 to 12. What lifestyle changes or medicines does folic acid supplement help?
Yes, that's a very good question, actually. See, I think in beta thalassemia trait, you shouldn't have any problem because of the thalassemia. But like any other normal person, you could also become anemic. So normally 10 to 11 will be your hemoglobin. Your cell size will be slightly lower. So that is going to be normal for you. You must have had blood tests done in the past, and you would know what your normal baseline hemoglobin is. So my suggestion is, if your blood count hasn't changed that much, and you're able to have the same performance activity, the physical activity, then just continue leading your normal life, your healthy lifestyle. But supposing, say, if you are tired, weak, and your hemoglobin has dropped, then you probably need to do some tests to see what type of anemia you have, because beta thalassemia trait is there. On top of it, you might have something else which needs to be teased out, and that needs to be addressed. Now, folic acid, I see this as many people with beta thalassemia trait are given that. See, folic acid is not required for a patient with a trait strictly, because folic acid is given to people when there is excessive production of cells and they are being destroyed. Then the folate enzyme gets consumed. But in thalassemia trait, seriously, that doesn't happen, so you don't need to take folate unless you are folate deficient from your diet. And again, to have a folate deficiency in your diet is very uncommon.
Yes. Um, Here's Karthik's question. Does any prolonged abnormal CBP test indicate underlying disease. Example, high PWD, MPV, PCLR, age is 30-year-old.
Sorry, say again. High?
High PWD, MPV, and PLCR.
This
Paxil,
is what
MPV,
test?
yeah.
High PCV. You mean
CBP,
pack cell volume?
yeah,
PCV, and
yeah, I
which one is
think.
the other one?
PWD,
CBC.
high PW. It's a CBP prolonged abnormal result.
I'm
Does
not sure
any
whether he's
prolonged
meaning to high PCV, which is PCV or
could be
HCT comes
MPV?
as mean platelet volume,
It,
MPV. MPV
yeah,
means mean platelet volume. That means your size of the platelet is slightly bigger than what it should be. What we call as giant platelets. People from the northeast usually have a higher MPV and giant platelets, and that is quite constitutional. You don't have to be worried about that. But the other thing which you raised, the HCT or the PCV, which is the hematocrit, that means your blood cell content is more. So now again, this is a big topic on its own. Why do you have high blood cells? We have to see whether it's bone marrow which is producing, or whether because of any secondary stress due to low oxygen, or any problem with your stomach or kidney or anything which is causing it. Again, this is what we call as polycythemia. So we investigate you to find out whether you have a primary or a secondary. Then we go on to do even bone marrow studies and things if we confirm that it's polycythemia.
done. Karthik is PWD is platelet distribution width. PLCR is platelet to large cell ratio. He's just
Hmm.
typed back his query.
Okay, sure.
These are high.
So that is the
Very
MPV,
distinct.
which I said, the giant platelets, which means in Northeast population, it's quite usual to have that.
If he is not from Northeast, Karthik, can you quickly type which area are you from and when did you diagnose this? So this is something interesting that our genetics and the region or geography has a play on our blood distribution. This is so interesting
Yes,
to learn.
Southeast Asians and people who are in the Northeast, and also even some Asian South Indian people have a little bit bigger platelets, what we call as giant platelets. And if you look at them, they work better. And if you count in the machine count might be lower because machine will
Okay.
read by the size of the cell. But if you look at them by a film, by microscopy, you will know that they are normal in numbers. So I don't think you have to worry. It's just uh,
So Karthik is from
physics check.
Hyderabad and from last 1 year he has observed this.
Okay, and his platelet count is normal.
Platelet distribution width. Karthik, can you please type this back and I will wait for his thing. A lot of people are asking about platelets, doctor. We'll come back to one platelet after Karthik's address. We will come back to platelets because there are so many questions about platelets. I can't tell you. Right from our first question to the latest question, it is all about platelets. And coming back to
Okay.
Karthik, 100 to 150 is what he said.
Okay, I think
That is
that
the blood.
explains it. As I said to you, the Coulter monitors by your size of the cell. So that is the rays goes and hits the cell and then it counts the platelet. So it is actually designed or programmed to count platelets which are of the smaller size. But if your platelet size is bigger, so then what happens is the Coulter won't count it. But then when you look at the optics of it, the platelet diameter is bigger, and then again when you look at the film it is adequate in number. So basically what is happening is you have got enough platelets within you don't need to worry about it, but the machine will always count it a little bit lesser because your platelets are bigger in size.
Done. So, Mr. Barua is asking, Dipankar Barua is asking, is beta thalassemia also more prevalent in Northeast?
See, again in Asian, I think, say in Indian population, beta thalassemia is quite common, and again you will see Northeast it's very common as well, and again in South India as well we do see, and also if you take Southeast Asia, again it's prevalent. Then in Greece, it's where the Cooley's anemia, the name initially derived from Greece, the Mediterranean also, it's quite common.
Yeah. So, doctor, now coming to the platelets issue, lot of people are asking about platelets. Mr. Anil Kumar Sharma is asking about platelets. Anil Sharma is asking about platelets. Like he's a 60-year-old. Is it normal to have a male 60-year-old having 11 grams of hemoglobin and platelets are all about 1 lakh to 1.5 lakh since last 2 years? That is one question. Then hemoglobin, Asha Rajesh. Asha is 45-year-old. Hemoglobin level does not increase more than 9. Platelet count is 5,51,000 and I feel tired all the time. And also ITP ke bare mein bhi a lot of people are asking. Is there a permanent cure
Okay.
for ITP? Can we take all the
See, I
platelet
think
questions
the
one?
lady who just now, Asha, I think hemoglobin 9
Asha.
and platelet 550, and she says she's feeling tired. I can say to her, okay, this is one spectrum. If your platelets are high, because normal range is between 150 to 450, hemoglobin normally will range somewhere between 12 to 15 or something. So you're like baseline, less than the baseline by 2 grams, and also your platelet is slightly up. So if you look more into detail, I think probably you're anemic and you've got a raised platelet. Now, the commonest thing without saying is, one is you might be iron deficient, and that is why there is a reactive increase in your thrombocytes. So my suggestion is, you will have to check your iron levels and you have to check your diet, whether you're taking enough adequate diet. And I didn't get the age, and especially if you are in the uh,
45, doctor. Asha Rajesh is
45
45.
age group, then you have to check whether your periods is okay, and also whether you're not losing blood from anywhere. So I think it might be just a dietary related iron deficiency which is pushing the platelets up. So if you treat that, then it should return back to normal. So that's quite one end of the spectrum. The other end of the spectrum is where you said the first
Low
patient who
platelet.
had the hemoglobin of 11, platelet of 100 to
11.5. Anil
150.
Sharma.
Yeah, even though it's not within the range, this is what we see normally. So now what we do is we first assess them and see whether they are okay in themselves, whether they're not losing weight, and whether the blood cells look okay. And we see a trend. If we see a trend and they are okay and they have been stable over a period of time, we just don't do anything, we just observe them. Whereas if you see a downward trend, then that might mean there is a early signs of some bone marrow problem or some vitamin deficiency which is happening. Then I think you need to look at it in a greater detail. Now, as we all get older, our bone marrow also gets older. So the bone marrow normally produces three types of cells: red cells, white cells, platelets, and all the three cell lines can actually struggle to produce the enough numbers. And even when they produce, they can look a little bit abnormal. So that is something which we need to bear in mind as time progresses and as age progresses. If your blood counts come down, then it might be something where your bone marrow is struggling. Sometimes it might just be a vitamin deficiency, you just need to replace it, it'll get back on its own. Or sometimes it might be something complex where the bone marrow is suppressed, and when we look at the bone marrow, we identify it and then we kick start it with some medicines. Now, the other end of the problem, what you discussed, is the platelets. Again, see, platelets are produced in bone marrow. Some people, the most commonest thing what people have with platelets is it's being produced and it's being destroyed. What we call as ITP. ITP means immune thrombocytopenic purpura. The bone marrow is producing, the body is destroying. Now, it could be without any reason it's doing it, or it could be because of some other cause which is happening in the body which is causing it. Now, off late, not to alarm the viewers and everyone here, in COVID, we have seen a lot of patients who have had ITP. Now, any infections, viral infections. The other day, I saw someone who went for a dental extraction, like a small procedure, then ended up having a low platelet a week ago. Uh, so it can vary from a viral infection, from a dental extraction, even vaccinations. Live vaccines sometimes can trigger ITP, and we
Not
have
in all.
seen that as well.
No, like, again, not,
Not
let's
in all,
not
very,
scare.
very rare,
Not
very,
in all.
very mild, very, very mild. So it's not something which we would say, but I'm just giving an example. So, or sometimes without any reason, this can happen. So when it happens, we need to first diagnose it, and then we need to give treatment. We give treatment when the platelet count goes below 30,000, or when someone has got symptoms, or we need to raise the count because if they're going for any operation or any surgery. Now, the treatment for ITP varies from newer
So here's a
thrombopoietins to steroids. Yeah.
yes, doctor. Here's in continuation with the topic that you're talking. Saravanan Ramalingam is asking, my daughter's 12-year-old has ITP since 2019. We are consulting a doctor regularly, but still not taking the medicine Dapsone tablet. The platelet counts have been between 50,000 and 75,000. Please advise. So I think you
Yes,
were
I think,
approaching the
okay. Yeah, so we are talking now here about childhood ITP. Childhood ITP again, there is acute ITP, there is chronic ITP. When they present, what we say is we give them some treatment if it is necessary. They go into remission, but some people don't go into remission. That is, the platelet doesn't normalize, so it stays somewhere very low. So then you start using other treatments. And one such treatment, I think what's being used is the Dapsone treatment. Now, initially I said platelet count should be 150 to 450,000. When you go below 30,000, we give treatment, because the reason is if you go below 30,000, then the chance of bleeding and bruising happens. But then if you have 50 or 70,000, then that is quite a very good count. And Dapsone is quite a safe tablet to take as well. And so, having chronic ITP, taking Dapsone, maintaining between 50 to 70 is very good. So I think you just have to continue that. And uh, unfortunately, it's one of the things where you need to take medicines for a long time.
Yeah. And here's something about polycythemia, vera
Mhm.
JAK2 negative. Uh, I'm not sure if I'm pronouncing this right. Phlebotomy done.
Yes.
Is that the right way to pronounce
Okay.
it?
Yeah.
Every 3 months. What is the prognosis and life expectancy? It's about a male who's 40-year-old. What should be done to have a healthy life? And something similar, suffering from polycythemia vera, World of Lucky is asking, 34-year-old. Last month I got diagnosed. Right now I'm having hydroxyurea and ecosprin. Done 2D echo. It's clear. Doctor advises bone marrow. What should be done further?
Okay, so the polycythemia, again, we classify it into two types. One is coming from the bone marrow, that is called as primary polycythemia. Then you have other types of polycythemia. Now, primary polycythemia is again what we say JAK. JAK is basically, if you take bone marrow, there is a mother cell, what is known as stem cell. That is where the growing, all the cells will come from there, the red, the white, the platelets. Now if that mother cell has some mutation in it, what we call as Janus kinase mutation V617F, that is the JAK2 mutation, then we say the bone marrow is actually having a problem in those stem cells, and that stem cells are responsible for producing lots of red blood cells. So if you have a lot of red blood cells, again, as I said, it's like a tube where the blood is flowing, and if you have more flowing, then you get obstruction, you get thrombosis. Thrombosis can happen anywhere, heart attacks, strokes. So what you have to do is you have to thin the blood down, you have to take the blood away, or you have to give some medicine like hydroxyurea to suppress it. So long term, the prognosis is quite good, because you have to maintain your blood hematocrit values above a particular level, which is 45%. You continue to take the tablets. From time to time, we have to monitor your spleen size, make sure that the marrow is not getting scarred, and we have to follow you up. I think long term is quite good. Another important thing is you have to watch out your blood sugar, your cholesterol, because there are other increased risk factors for stroke. So lifestyle modification also is going to be important. Now, other important things, smoking and alcohol. Smoking will again cause hypoxia in the long run. It actually causes increase in your red blood cells. Again, alcohol will also cause the same problem, will make your blood go up. So most of the patients whom I see is secondary polycythemia. If you go into their history, then you find out about this, then its lifestyle modifications makes them better. So that is what we call JAK negative polycythemia. So if patients are JAK negative, both the mutations we have tested, then we say it is JAK negative. Then we have to rule out whether it's secondary due to any problems in the stomach, like any tumors, or whether it's due to excessive alcohol, or whether it's excessive smoking. So then we modify those risk factors. If the risk factors are modified, then your blood returns back to normal. Then you don't need any treatment. Until the risk factors persist, you might have to take the blood out. And that was your other gentleman's question. Yeah.
Yes, doctor. Here's Navita Gupta. I'm detected with factor V mutation and I'm pregnant in second trimester. Taking Claxane 40 mg. Still my activated partial thrombopalestine time is below average. Is it a risk for my baby?
No, actually, see, I think that's a very good question. Okay, there are two parts of this question. Now, pregnancy in itself will make your blood clotting times shorter. So, if the blood, say, for example, is clotting at 30 seconds, it might clot 27 seconds or 28 seconds. That is because a lot of proteins in the body are increased during pregnancy. So, that is normal physiological thing. Your clotting time gets shortened. So, you don't have to worry about that. That is number one. Now, factor V Leiden mutation is basically a mutation which is very prevalent in the general population. Almost around 5 to 7% of the Caucasian population and 3 to 5% of our population also have this mutation. Per se, on its own, doesn't cause any problems because many people will have this mutation. But say if you've had a problem in your previous pregnancies, if you've had a blood clot, or then I think your doctor would recommend you to take these injections till the pregnancy goes. And sometimes we do 10A level monitoring as well to make sure you're adequately anticoagulated. So I think that shouldn't be a problem.
Done, done. Mr. Shivam Roy, you've been asking a question. Patient is 53-year-old, remission for multiple myeloma lifespan, and I suppose you also have treated. There's not much of question here, but multiple myeloma ke bare mein, and especially remission
Hmm.
of his mother's multiple
Okay.
myeloma.
Yeah, I started hearing about multiple myeloma in the 90s, when I met a professor. At that time, when a patient walked into the room, he used to say, don't worry, you will live at least for another 10 years without any issues, because that in the late 90s, when thalidomide and lenalidomide and immunomodulators were introduced, we said, okay, anyone could live for more than 10 years. Now, I think I would double it as well, because the last 10 to 15 years has seen a massive expansion of drug development in multiple myeloma and also monoclonal antibodies as well coming. So I think the prognosis looks very good for multiple myeloma, better than ever before, but still a lot of work needs to be done. Now, multiple myeloma is a cancer of the bone marrow. Basically, the most important thing there is what we need to see is how your genes are when your myeloma is active. So we do that by checking your bone marrow cells, and we see for certain genes whether you are at high risk or whether you are at standard risk. So and also there are some medicines which are available we can use for high risk, and the normal medicines we can use for standard risk. So by using these medicines, we can make the patients live longer, have lesser complications as well. So it's quite positive news.
All right, great. So Shivam you can consult back in case further details that you have typed. As doctors treated your mother, you can continue, and there's a positive response from doctor as well. I know that when people are taking care of their loved ones, they're more concerned and they keep asking us questions. Please understand our paucity of time as well. Dr. Rajat Bhadwar's next question. We detected with minor thalassemia at the age of 37, and I have two kids and have low hemoglobin level, ferritin, and no iron binding also. So, and that's, and also somebody is asked about both father and son have thalassemia, and he was asking, is it genetic and how does it
Okay.
prognosis?
Okay. Okay, so if you take the genes mapping, there is hemoglobin has heme and globin. In the globin, that is the protein, there is alpha and beta. Alpha has 4 chains, beta has 2 chains. So you will get two from each parent. So if you take the beta for example, if beta both the genes are affected, then it becomes major. If one gene is affected, it becomes minor. So for example, if you have one normal parent and one person with thalassemia trait, then the possibility is there could be a person in the family with a trait. Now the problem becomes when both have a trait, then you could have a baby, 1 in 4 chance, who has a thalassemia major. Now there is government initiative as well in the northeastern states all, and I think a lot of education is being going on as well, and free counseling before marriage, and testing as well of the person who's getting married, and also the partner as well, is all being offered as well. And also there are a lot of voluntary organizations as well which are doing testing of the children as well to see if they are thalassemia. So my advice when I see someone who comes for this thing is, okay, if you have a thalassemia, I ask them, okay, I see whether they are married or they are not married. If I counsel them saying them, okay, you have a thalassemia trait. If you marry someone with a thalassemia trait, this will be your chance. If you marry someone without a thalassemia problem, then there is no risk. So then at least they're aware of it. So they can make an informed choice when they're getting married to someone. Now, it might not be possible to avoid everything, because you might say both people, they do want to get married, they might have thalassemia trait, and I've had patients consulting that as well. Then comes the higher technology where we say, okay, that 1 in 4, does that baby have the thalassemia major? Then we go for prenatal counseling, then we do the chorionic villus sampling and things to see whether that gene what we have located in both the parents is still there, and then we can offer them advice whether what they want to do. So I think a lot is available now in terms of diagnosing it very early and also finding out even before the baby is born.
So this awareness is very important. On this Thalassemia Day, I think we need to call uh, people to understand what thalassemia is and how can they address their issues. So it should not be a social taboo, according to have a healthy life,
Absolutely.
to have a healthy family. It should not restrict them from having a normal
Yeah,
social
and
life.
I think the government also has actually, given a lot of assistance. As I said, you can diagnose the children, and you can also, blood transfusion is now available for these conditions without any expense
Subsidized
as well. And also iron chelation is also being available at all thalassemia centers as well. So I
centers. Yeah.
see when I go to northeastern states, patients, they have the book where they are diligently writing down the iron levels, are taking the iron chelation. So it's very rewarding to see these kids growing.
Good. So I hope Murlidhar Pratihar whose father and son, both of them are suffering with the thalassemia. I wish you best of luck and may your child get more power and more awareness and more information about thalassemia. That's the only way you can help your child. All right, doctor, here's next question from Papori Das. I'm suffering from leukemia last year, December. Number of BCR ABL is 56 now. It's 5, but my skin, there are multiple blood spots. Can you please ask doctor why is this happening to my skin? I think it's bruising that he's
What
talking
tablet
about.
are you taking? Is it imatinib, nilatinib, or dasatinib?
Mr. Paporidas, will you please text and type what you are taking right
I
now?
think
So,
most likely Sir is having chronic myeloid leukemia or CML, where BCR-ABL is positive. Now, initially we used to give imatinib, and then we used to give the newer versions of medicine, the nilotinib and the dasatinib.
imatinib 400 mg is what he's taking,
That's what
doctor.
I thought. See, I think imatinib was introduced first in the mid 90s. I think the IRIS trial, which used imatinib first, found out that if you gave imatinib, in the first 2 years, the dropout rate was almost around 30 to 40%. This is because of the side effects what the drug caused, the skin rashes and everything. Then I think in the mid 2000s, it's like the 1G, 2G, and 3G and the iPhone. Now we have developed the second generation TKIs. Now, when we use the second generation TKIs, this side effects don't happen that much, and also the faster response is there, and we can assure you of remission within 12 to 18 months. So I would suggest it's possibly time for you to switch your medicines from the first generation to your newer generation.
Yeah. So Arpita Roy's mom is having 55-year-old having multiple myeloma. She's under medications. A test done recently, M band not detected. what is the risk?
Yeah. So if she's myeloma and her M band is not detected, that's very good news. That means she's heading into remission. And I think with remission, see, myeloma is like diabetes and hypertension. What we have understood in the last few years from the Italians is that you treat like diabetes and hypertension with continuous medications, that is maintenance. It doesn't come back. The progression free survival and the overall survival is higher than when you don't treat. So I would suggest you continue on with the treatment, maintenance, whatever we give, like imids, lenalidomide or something, and I think the myeloma won't come back for many years.
Yes, Doctor. Good. Francis Xavier's next question is 36-year-old male. I'm an MM patient undergoing chemo for last 4 months. What are the risks and side effects of auto BMT? What is the success rate and lifespan after BMT? Are there any alternative treatments to BMT?
Okay, so see, again, this is a very good question, and I think it's a very in-depth question as well. So I
Correct.
have
Only
to
on bone
do a bit
marrow we can
technical.
do one when the entire
See,
this
auto
BMT.
BMT, yeah, auto BMT means you take your own stem cells after you go into remission and give it. Normally, we say it gives you 18 to 24 months remission. Okay. Now, the normal drugs, see, there are two ways to answer this. If you were a standard risk myeloma, that is with no high risk genes, the treatment what you had initially should give you a progression free survival of around 12 to 14 months. Now, an auto transplant would give you 18 months. Okay, so this is one part of the question. If you're high risk, then I would say yes, auto transplant is the choice for you. But if you're standard risk, you could argue it two ways, because there was a study in the US where they did the same way. Patients didn't want to have a transplant. They left them on and they treated them with the subsequent medicines after 2 years. And then they were able to transplant almost 50% of the standard risk. So basically, if you are standard risk, and you don't want to have a transplant, this is not the end of the road for you. You still have another choice at it when it comes back later.
Wonderful, doctor. So, Sampath Kumar Silveri, I'm suffering from SVC DVT in the right hand. I'm on Dabiclot 150, Daflon 500.
Dabigatran.
But yeah, but pain has not subsided. Age is 50-year-old female. I've been affected with COVID in May to 2021.
Okay. See, again, with blood clots, the thing is there's obstruction to the blood flow. The blood has to flow through some other route. So what it does is it finds other channels to flow. So what we call as collaterals. So when blood is flowing through other channels, what happens is that you get pain and swelling. So it is what we call as chronic thrombosis of the syndrome, where you have pain, swelling of that particular area. See, if it's the leg, it becomes a little bit easy for us. What we could do is we could give you compression bandage and things, and we can make sure the uh, blood flows back, and within 1 to 2 years, it could come down. Now, this is something where you just have to have chronic treatment. And the only other thing is, again, rescanning would be useful, because to see whether from the old scan to now, whether how much collaterals are there and whether there's again further blockage as well. So I think it would be useful for you to consult a doctor to see whether there's progression of the clot or whether anything needs to be done from that perspective.
Yeah, done. So, Mr. Sampath Kumar, please go ahead and get a scan done again. So, here's an MBBS student who's 22-year-old, Shravan. RBC 7.5, HB 14, MCV 58, and HBF 5.4, HbA2 normal. This suggests Mentzer ratio above 13. Does it mean delta thalassemia? Too many details here, doctor. But
Yeah, see, it could be. So you have microcytic anemia and raised red cells. So that means to me you have some sort of beta globin problem. Now, this HB electrophoresis is just your preliminary typing. What you need is a beta globin gene analysis study. Then we can identify that mutation. And obviously, you are a medical student, so you would want to know exactly what is the nature of your problems. I would suggest you do a beta globin gene analysis.
yeah, done. So I think you should go ahead and get that done. Mr. Mishra, what should be done to reduce liver enzymes in blood? Non-alcoholic, husband's SGPT and short SHOT levels are very high.
Okay, that is a gastroenterology thing, but I'll still answer, because you liver test, I think you're probably better off with the liver specialist because to see if there's any local cause, they might want to scan you, they might want to see if there's any infection or anything before they prescribe you to live or some medicine.
Okay, done, done. Then, father has a condition where his hemoglobin raises to 19.8. I would like to know how can he maintain? Can this be done with diet?
See, hemoglobin 19.8 is quite high. That means it's polycythemia. As I said before, we need to identify, we have to take a history, we have to go methodically to see whether JAK2 is positive or negative, and then bone marrow and things. So then we can come to a conclusion why this has happened, and then we can treat it by phlebotomy or blood thinners, depending on what the cause is.
So you just don't take a chill pill. Please go ahead, consult a hematologist, Dr. Srikanth. Can be consulted over Apollo 24/7. Because by diet, I don't think most of these can be controlled, right, doctor?
Absolutely.
Yeah. Monica is asking next question. I'm having pulmonary vein thrombosis PVT and I'm taking warfarin from last 5 years. Is there something to worry about for long term? What are the precautionary measures that I should be taking?
See, normally we would give for 2 years if there is no any reason why you had the clot, and if it was the first episode of clot, there must be some reason, like in your blood, they found which is not modifiable. So maybe that's why they gave you. But I think, on the other hand, if you've been on that for 5 years and you're having normal fitness and you're able to have a good activity, then I think that's perfectly fine. So, and I think the only problem what you're having is you might have to monitor your blood thinning value, the INR, and also you might have some restrictions on your diet. I think in the last 5 years we had newer anticoagulants, which I already mentioned to one of the viewers, where you don't need to have any restrictions on your diet and also not to have any blood tests as well. And I think they are quite more, they work even fact better as well. So maybe that's something to consider as well.
Yeah. Vinay Gupta is asking, how long should a heart patient take antiplatelets tablet? It's more than 3 years that I'm continuing. Is there something called an
I think you
antiplatelet?
need to take it long term. It's like diabetes where you continue to take it because it protects you. It's given as secondary prevention, so you need to take it.
All right. So,
Mhm.
doctor, there are a lot of questions pending which I'll not be able to take in time. But in general, post COVID also has taken up a lot of questions. Myeloma, Mr. Shivam Roy, your question has been answered by doctor. Please do consult him with further details if you would want to. And yes, doctor, I'm just trying to see if I've missed any of those very important questions where we can,
Okay.
one last question if I can take. Uh, Yes, doctor. I think post-COVID clots, one necrosis in the hip joint and brain clots. This is one of those clot questions that I found. If you would want to answer that in the last.
See, post COVID, no, what I would say is you have to be a bit careful. I think it's each one's ownness now because the disease is also, I think, luckily, I think it's under control now. I think if you had a COVID and you are in a pandemic and things, and then it's not just the COVID time alone. Post COVID also you have to be careful. And I would suggest, if for any follow-up blood tests, to see if everything is returned back, all the markers of inflammation, your blood counts and everything. And again, one more important thing is, if you feel any symptoms of problem, like what can happen if you have a blood clot, the most important thing is sudden shortness of breath on exertion, chest pain, dyspnea, coughing up blood. This is sign of pulmonary embolism. Now, the other thing can be pain or swelling in your calves or anything that can be sign of your deep venous thrombosis. Then again, you could have blood clots in your brain as well, with headache, vomiting, eyesight changes and things. So if you have experienced any of this post COVID, and you say like within 6 weeks of the COVID, so I think don't ignore it. You need to consult a doctor so that they can look at it in more detail, because post COVID we do know causes thrombosis, and we have to be aware of that.
Done, doctor. Thank you so much. You've been extremely informative. Thank you so much. So before we take leave from you, I would want to give us some top tips, especially tips to understand what blood disorders are, signs and symptoms of blood disorders, when to consult a hematologist.
Yeah, I think, as I said earlier, bone marrow produces red cells, white cells, and platelets. If your red cells are deficient, then you get anemic. You might be tired, weak. So, and if you're not improving with taking iron tablets, then you do need to consult a hematologist. And if you're getting repeated respiratory tract infections or any infections, then again your blood count or immune system might be weak. That again might be another thing. And again, if your platelets are low, you're having bruising, easy bruising or bleeding, and again, that could mean your platelets are low. So you might have to consult a hematologist. And again, what we say is the warning signs of cancer, like unexpected weight loss, fever, night sweats, any lymph glands in your neck, armpit, bone pain. These things, I think you should consult a hematologist, because don't ignore it. You might be in the starting stage of something, and we could look at it, and if detected early, then we could diagnose it and treat it.
Wonderful, doctor. Thank you so much. You actually have spread so much of positivity and given hope. And thank you again for joining us on this Sunday morning. Namaste.
Thank you very much for having me in the show. Thank you.
Pleasure, doctor. Thank you. So it's time for me to ask you questions. You've been asking your questions, and now I'm going to ask you 3 questions in health quiz. Answer the questions over YouTube chat only. Winner's name will be announced towards the end of the show, and winners, you have to mail your contact details at marketing@apollo247.com. Gift vouchers will be shared with you. All right, to the questions. The first question for today is, what are the 2 types of blood cells in human body? What are the 2 types of blood cells in the human body? I'll give you a clue here. Think of a color. Think of 2 colors and you're there. All right, and question number 2, when is World Thalassemia Day observed? When is World Thalassemia Day observed? If you have been watching the show right from the beginning, you know when it is. Question number 3, where can you find health articles and resources in the Apollo 24/7 app? Where can you find health articles and resources in the Apollo 24/7 app? Very simple question. App kholo aur dekh lo kahan hai. If you don't have the app, download the app and see. Type your answers in the YouTube chat box only. We shall select the winners, and the winners will be selected at the sole discretion of Apollo 24/7. All right. Now, time to give away gift coupons and coupon codes. For this week, direct from Apollo Doctor Consultations, you get 150 rupees off on first online consultation. You have to use this code FIRSTVC on Apollo 24/7 app. Terms and conditions, of course, apply, but you get 150 rupees off on the first online consultation. Right. The other coupon that we want to give away today is First 3. Order medicines direct from Apollo, get 25% off on online medicine orders. Use the code FIRST3, FIRST, and numerical 3. While I'm waiting for our winners on YouTube today, I'm also going to give away certain coupons which you can use on Apollo 24/7. HH247, remember Health R, and use HH247 to get 199 off on online consultation with Apollo doctors, and up to 20% off on medicine orders. For this, simply you just have to download Apollo 24/7 app and then start using the app with all these coupon codes. Make sure that your experience is more smoother. So this is for this week. All the coupons are given away. I'm waiting for the winners to be selected by our team. And before we leave, next week we are getting back with an interesting topic. We're going to talk about urinary tract infection, myths and home remedies. How much do they work, and who needs to consult a doctor? Tune into Health Hour on 15th May 2022, 11 a.m. We shall answer your queries about UTIs. Well, the winners for this week are Francis Xavier, Mohammad Ahmed, and Sai Srujan. Congratulations. Please write back to us and get your gift vouchers from Apollo 24/7. Thank you all for joining us today. It has been a great and insightful session because of your questions, and I hope we could answer majority of your questions. paucity of time, I cannot take more questions than what the time permits. But thank you all for joining us on this Sunday morning. See you next week.